I thought I would bring that perspective to the topic today, is the issue of pandemic preparedness. And if there's one message that I want to leave with you today, based on my experience, and you'll see that in a moment, is that there is no question that there will be a challenge to the coming administration in the arena of infectious diseases, both chronic infectious diseases in the sense of already ongoing disease. And
let's return to our top story tonight. Scientists who told us COVID-19 came from a wet market privately suspected it was a genetically engineered virus. Yet they wrote a paper published in prestigious journal Nature Medicine insisting such a possibility was a conspiracy.
But she's had the flu for 14 days. Should she get a flu shot?
Well, no. If she got the flu for 14 days, she's as protected as anybody can be, because the best vaccination is to get infected yourself.
And
so
if
she really has the flu, she definitely doesn't need a flu vaccine. If she really has the flu,
she should not get it again.
No, she doesn't need it, because it's the most potent vaccination is getting infected yourself.
And that's why we've been asking people to stay at home during this pandemic. And though huge numbers are complying, and I thank you all, the time has now come for us all to do more. From this evening, I must give the British people a very simple instruction. You must stay at home.
Boris Johnson, his wife Carrie, and 15 staff members were pictured sitting in the garden of Number 10. The photo was taken after a press conference, during which the then Health Secretary Matt Hancock urged the public to stay at home as much as possible.
Please, stick with the rules, keep an eye on your family, and don't take risks.
That same month, Downing Street staff were invited to a Bring Your Own Booze party. An email inviting more than 100 employees to the event was sent by Boris Johnson's principal private secretary Martin Reynolds, and later obtained by ITV News.
Say what? Say what? So you're imposing a medical product on the European citizens without them knowing what's in these contracts? Not only them knowing, but us, we don't know. So after a lot of pressure in the parliament, as the article says, these contracts were disclosed to us and to the public. And I want to show you some of those pages. And you tell me if this is okay for the European citizens to be exposed to this situation where they cannot come to work, they cannot enter a store, they cannot go with their kids to schools, where they cannot freely move from one country to another, unless in one situation is vaccinated with one of these products. So these are the contracts that were disclosed by the Commission with the approval of the company.
One of the things that we also know after looking at this for 2 to 3 years is that the mortality from COVID is very similar, if not less, than influenza.
लिबरल का ऐसा